Hemifacial spasm is caused by involuntary movements in the muscles innervated by the facial nerve, and you have one on the left and one on the right. In nearly every case, it's caused by a blood vessel that's touching the nerve just as it leaves the brain stem. There are less common causes. In some cases, it can be caused by a tumour originating at the base of the skull, and rarely by other conditions such as multiple sclerosis, or it can be a side effect of previous facial palsy. In the large part, hemifacial spasm is diagnosed by seeing a specialist who sees this condition regularly. And patients will have a very characteristic pattern in their spasms. But we need to work out what's causing this. And so very often it will require a high resolution MRI scan to look at the nerve and just see if there is a blood vessel as suspected touching it as it leaves the brain stem. Some patients will elect to monitor their spasms if they're mild and not causing too much bother, but often they will get worse with time. In this situation, we have two options, one of which is to use Botox. Botox is an injection into the muscle to make the muscle weaker, to reduce the intensity of the spasm. For some patients, this will be enough and they will find that tolerable. In others, the spasms will get worse over time. They look for other options, one of which is surgery called microvascular decompression. In most cases, microvascular decompressive surgery goes very well, and only in a small percentage will there be side effects. Unfortunately, those risks or side effects can be serious, and these are largely related to the region of the body that we're operating on. The facial nerve comes out of the brain at the very base of the brain, called the brain stem. Adjacent to the nerve are other important structures like the hearing nerve, nerves which control and coordinate your swallow, nerves which coordinate and detect your sensation in your face, as well as blood vessels which supply your brain stem. So there is always a very small risk of a significant side effect, such as hearing loss, facial palsy, and stroke. But in the majority of patients, and by which we mean 85 to 95%, there will be a significant improvement with surgery. In fact, their spasms will be resolved. The recovery, surgery tends to involve 2 to 4 days in hospital, and the recovery is usually 8 to 12 weeks to get fully back to normal activities of daily living. But most patients will get through surgery well, and within a couple of weeks will be feeling able to potter around at home and get back slowly to normal activities of life in general. So to improve the outcome from microvascular decompressive surgery, the best bet is to see a surgeon that does this treatment regularly and has experience in this area. It also requires the patients to be appropriately evaluated preoperatively, so by getting the correct scan so that your surgeon can work out exactly where that compression is, allows them to direct their surgery accordingly to minimize any injury or retraction of any adjacent structures. Also, patients need to be as fit as they possibly can for surgery, so being correctly optimized in terms of your blood pressure control and other medical conditions is absolutely paramount too. And also, this needs to be conducted in a place where you have a team of surgeons, a team of nurses and caregivers that can have experience and look after you and know what to look out for in case there is a problem.